Ed Hess has cruised across America's highways for the past 40 years.
Oh gosh, I go anywhere from state of Washington to Miami, Florida, over into Pennsylvania, Maryland. I like the serenity, I guess you could say. I don't know, I just enjoy it. I like meeting different people, seeing different people. I just have fun doing it.
Ed unexpectedly met a lot of new people when traveling through Franklin County last September.
I went to our yard in Orrstown, Pennsylvania, and as I was dropping my trailer, I stood up and something just exploded in my left lower side, stomach area. And before I knew it, I done dropped to my knees. And then I'm telling myself in my head to stand up. But time I told myself that, well, now my face is in the gravel.
A nearby driver saw what was happening and called for help.
In the ambulance, they told me that they're going to try to save my life. And at the same breath, they shoot me with morphine. And of course, all I could say was, okay.
At Penn State Health, Ed met vascular surgeon Dr. Castello Ramirez.
I met him in the ER at that point. He was stable. He was able to talk to me. I was able to tell him what had happened, explain to him the findings of the CAT scan. So he had a ruptured aneurysm, which is basically his aorta was bigger than usual, and that basically ruptured, so he was bleeding inside.
Dr. Castello drew me a picture on the wall in the ICU room, and she explained that the aorta ruptured, and she said it's pretty massive.
We took him up to the operating room where he was put completely asleep. We were able to successfully place the stents in his aorta to exclude the bleeding, and that way stop him from bleeding into his belly.
She said she put 3 stents through it, you know, and so she was pretty blunt, and she told me I was a lucky man.
This is a pretty mortal event. I mean, our technology has allowed us to take care of these patients very efficiently, but pretty much patients could die, and they have an 85% mortality depending on the center that they present at and how efficient and how rapid we can get to them.
I never really thought much in depth until they told me it's just a handful that survives this, you know. And then you really get thinking about it. Wow, you know. It's hard to believe, I guess.
Ed spent a week in the hospital, stayed with his nephew for a month to recover, and then returned to Penn State Health.
She deemed I was cleaned up and looking good, and I wasn't pale no more. I had my color back, and she was pretty much ecstatic with it, you know. And she is a sweet doctor as far as that goes. She's very, very good.
He was taking all his blood pressure medications. He was taking his diabetes medications, and he was very happy. He was feeling good. He was back to work, so it was pretty rewarding for me to see him in that shape.
I feel great. It couldn't be no better, you know. It really makes you think, you know, that I guess I've been blessed on that behalf, given this second chance.
It makes all my bad days and everything just disappear, and it just makes me happy. Makes me realize how all the hard work that I do is worthwhile.